Imagine being able to diagnose complex conditions with the same intuitive skill a master chess player sees board positions, not memorizing every possibility, but recognizing patterns that reveal the truth. In medicine, pattern recognition isn't just about memorizing symptoms and diseases. It's about developing the cognitive ability to see connections that others miss. When experienced physicians look at a patient's case, they're not just ticking boxes, they're seeing the story written in data points, lab results, and subtle clinical signs. The science behind this fascinating process lies in how our brains process information. Medical experts don't store thousands of separate diagnoses in their minds. Instead, they develop complex mental frameworks that allow them to pattern match new cases against similar ones they've encountered before. This is why seasoned doctors often seem to just know what's wrong. Their brains have optimized this pattern recognition through years of exposure to diverse cases. If medical diagnosis is essentially pattern recognition at scale, why do we still teach medicine as memorization of isolated facts rather than as development of pattern recognition skills? Consider how chess masters work. They don't memorize every possible board position. They recognize patterns and principles that allow them to evaluate situations rapidly. Similarly, the most effective medical diagnosticians develop mental frameworks that help them quickly identify which questions to ask and which tests to order. To develop this skill yourself, start by systematically studying case studies. Don't just read the diagnosis, analyze the reasoning process. What clues led to that conclusion? What alternative diagnoses were considered and ruled out? Keep a pattern journal where you document similar cases you encounter, noting the key distinguishing features. The future of medical education increasingly emphasizes pattern recognition training over rote memorization. Virtual reality simulations, artificial intelligence case generators, and collaborative pattern sharing platforms are all being developed to help medical students develop this crucial skill earlier in their training. Remember, in a world where medical knowledge doubles every few years, the ability to recognize patterns and reason systematically becomes more valuable than memorizing facts that will soon be outdated. The truly great diagnosticians aren't those who know the most, they're those who can see what others miss.